Ketika showed us some very good and illustrative examples on how patients can be satisfied with the work of nurse practitioner. I will continue with this story, but I will present a more quantitative study, and I will present a new tool that was developed in Slovenia in order to measure the patient satisfaction with the work of nurse practitioner. The aim of this my lecture is to present this tool and, of course, to present the opportunities for its implementation in praxis. We already talked about what is nurse practitioner and what does nurse practitioner do. This is one of the definitions of the nurse practitioner, and the main tasks of them are health promotion and leading role in the routine follow-up of patients with chronic disease, which is also the case in Slovenia. Janko already presented the idea of model family practices. In this study, we aimed to measure the patient satisfaction with the nurse practitioner as the new member of the team, of family doctors team in Slovenia. Of course, this pilot project had many aims. One of its aims was also to improve the quality of care of patients in primary health care. The patient satisfaction, that's why we decided also to measure the patient satisfaction with nurse practitioner. The patient satisfaction with family doctor in Slovenia has already been extensively studied, and it showed overall good, high levels of patient satisfaction, but it also revealed some gaps in satisfaction, mainly in the aspects of organizational aspects of care and in connectional aspects of care. And therefore, we also wanted to know whether these gaps could be filled by nurse practitioners. So the aim of this study was to design and test a new tool for patient satisfaction with nurse practitioners. We did a cross-sectional study, and we included 7 model family practices in Slovenia. We wanted to include 30 consecutive patients who visited nurse practitioner. They should be aged 30 years or more, because 30 years of age is the age when the screening starts by the nurse practitioner, and of course there had to be the indication for a visit to nurse practitioner. We used the self-administered questionnaire that was given to the patients by nurse practitioners themselves. The questionnaire consisted of some demographic data and of the nurse practitioner evaluation scale, which I will present briefly in the next slides. The nurse practitioner evaluation scale was developed by the researchers. It was based on the Europep questionnaire, but it was adjusted to so that it could relate to nurse practitioner's work, not to the work of the physicians. The scale was reviewed and approved by 2 independent experts, and the scale itself consists of 16 questions. They could be answered on a 5-point Likert scale, from 1 point poor and to 5 points, which means excellent. As you can see, the convex alpha was very high. So the scale was proven to be reliable tool, and therefore we could calculate the composite score of this scale. We used Henshaw equation. So the minimum points that could be achieved is 0, and the maximum points that could be achieved on this scale is 100. We also did the factor analysis to detect possible factors that constitute this scale, and then we also did some bivariate analysis in order to detect associations between demographic variables and patient satisfaction. We had 170 completed questionnaire, which was a very high response rate. We had more than half of women patients, and almost half of the patients were employed or students, and almost half of the patients had a chronic disease. The mean age was around 50 years of age. The results showed that patients were very satisfied with nurse practitioners because the mean total score on the scale was almost 90 points, and the analysis showed that the highest evaluation was in the comprehensive approach and connectional aspects of care, mainly in confidentiality and communication. But the lowest satisfaction was within the person-centered approach. This table shows the items on the scale and the percentage of respondents who answered with 5 or 4. So on the scale, this shows the percentage of respondents who were satisfied with these items. So you can see that they were mostly satisfied with the confidentiality and comprehensive approach, but less satisfied with this person-centered care. The factor analysis revealed 3 factors, 6 items loaded on clinical approach factor, 5 items loaded on comprehensive approach, and 5 items loaded on patient-centered approach. The factor analysis explained almost 70% of variance, which is a lot, and also the convex alpha for individual factors was very high. So we can say that these factors were really the right ones. And we can also say that this scale can be used in terms of one factor and also in terms of all 3 factors. So what were the main findings of this study? The nurse practitioner evaluation scale proved to be a reliable tool for measuring patient evaluation of nurse practitioners in primary care. We detected 3 key factors on the scale, and as I said before, in praxis, this scale can be used as a whole scale or in terms of the 3 separate subscales, according to what your aim is. Then I also compared this tool to other tools which had already been developed. We have several tools for measuring patient satisfaction with nurse practitioners. This is some old tool with these factors included. These are some new tools, and here I listed the factors that are included in these tools. You can see that they are quite similar to the factors that we discovered. The clinical approach factor discovered in our study could be found also in other tools, which I listed here, and also it can be found as a core competence in some of the frameworks that deals with the role or with the competences of nurse practitioners. Then the second factor, we found the comprehensive approach factor has not been recognized in other tools. and it has only been recognized in one framework. This is the framework from UK. But as our study showed, the comprehensive approach seems to be very important to patients. So it should be included both in the tools and also in the frameworks dealing with this topic. And the third factor, patient-centered approach, was also recognized in other tools and also as a core competence in frameworks. In our tool, we failed to recognize some other factors that were recognized in other tools or in other frameworks, such as time management and accessibility. So maybe our tool does not cover all of the competencies of the nurse practitioner. These are the limitations of our study. The big limitation is that we did not randomly select the mother family practices, and also nurse practitioners collected the data themselves, and this too can be the source of selection bias on the side of family medicine practices, and also this could be one of the causes for the failure of recognizing other important dimensions in nurse practitioner scale, as I represented, that were recognized in other tools. So what can we conclude from this? We have a new scale for evaluation of patient satisfaction with nurse practitioner in primary care settings. It can be used routinely in future research and also in quality measurements of the work of nurse practitioners. It can give the important information for developing and building the role of nurse practitioners in primary care, and it can also be used as one of the sources for the development of some international nurse practitioners' core competencies framework. Thank you.